So, how are men and women different when referring to the heart?
Historically, and if you want to talk about coronary artery disease or hardening of the arteries, is the most common heart disease. That's what kills people in this country. Historically, it was a man's disease. More men had the problem than women did, and we think that's because that the estrogen and the female hormones were kind of protective of the heart in women. So we didn't suspect that younger women were going to have heart problems, whereas men did. That has evolved to where now we recognize that there's probably just as many women with heart problems as there are men. It's harder to diagnose because their symptoms are different or can be different. And a lot of times, because of the history of we didn't think women were going to get heart problems at younger age, they're kind of pushed aside. That's wrong. Whenever a woman presents with some kind of symptoms, you got to think heart. And you just can't say, oh, she's a young woman, that's not going to happen. I saw young women in their 20s and 30s have heart attacks. It happens. Now, when you're talking about treating them, they're more difficult to treat, the women. Their hearts are a little smaller. The arteries on the outside of the heart, the coronary arteries, are smaller. They're more difficult to treat, particularly say if you want to do a surgery or what we call stents or dilatations or opening up the arteries with balloons and what have you. It's more difficult to manage. And women respond to medication somewhat differently than men do.